Good afternoon, everyone, and thank you for attending today's webinar, The Rise of Artificial Intelligence and the Future of Physician Practices, presented by Sam Cohen with Curry, a medical mutual company. Please be aware that there will be a question and answer portion today at the end of the webinar. To avoid frequent interruptions during the webinar, please type your questions in the question box located on the right of your screen. They will be answered in the order received during the question and answer portion. Additionally, the presentation slides have been emailed to all participants before the start of today's webinar, so you may print and take notes. If you did not receive the presentation, please email your state MGMA and I will be happy to get those sent over to you. And lastly, a recorded version of this webinar will be available on the website for members only following today's presentation. Again, we would like to thank you for attending, and I will now turn things over to you, Sam.
Thank you, Bria, and thank you to everyone for joining today. As Bria said, my name is Sam Cohen. I'm Senior Vice President for Health Policy at Curie, and I think we have a great presentation for you today on the rise of AI and the future of physician practices. Now, so what does it mean first to be a Senior Vice President for Health Policy at a medical malpractice company? And the key thing for today's context, for the context of today's webinar, is that at Curie, we recognize that all of you as practice administrators and the physicians that you work with, you're all busy running your practice day to day. Your nose is often right down to the grindstone, and you don't have time to pay attention to a lot of the higher level health policy discussions going into Washington, D.C., or the other health policy initiatives that don't impact you today, but might a couple of years down the line. And so what I'm given the freedom to do in my job is to spend my days looking at those issues and figuring out which of them are going to be most relevant to you coming down the pike so we can get that information to you. And AI is certainly one of those issues that I've been keeping a close eye on, and I think it's important for all of you to be aware of some of the developments going on with artificial intelligence right now so you can start thinking about what's going to happen down the road. So what are we going to talk about today? First, just a little bit of background. What is artificial intelligence? Why should we care about it? And then we're going to talk a little bit, not only is there this general idea of artificial intelligence, there's also this competing idea of augmented intelligence. What's the difference between those two things? Why does it matter to you? And are we on a path towards artificial intelligence or augmented intelligence? So an important question that you'll see sort of weaved throughout the presentation. After that, having all that background out of the way, we're going to move into talking about sort of operational AI. What is it doing just to help day-to-day operations in physician practices, in hospitals, and more importantly, not necessarily what it's doing today, but what it might be doing down the road. Then jumping from the operational side, we're going to jump to the clinical side, and sort of broke this down into three categories, but obviously these all sort of overlap a lot. Predictive tools, diagnostic assistance, and imaging analysis. And imaging analysis is really just a big subset of that diagnostic assistance. But of course, as we'll talk about, reviewing images is something that computers, artificial intelligence is particularly good at. And so a lot of the developments in AI, they're going to more immediately impact practices might be coming from that side of the house. And then now that we sort of have a sense of what's out there, what might be coming down the pike in terms of just the artificial intelligence tools themselves, we'll jump and say, well, what does this mean for physician practices? And obviously that's the big issue that we all need to grapple with. You always have new technology coming down the pike, but what matters is how it impacts the day-to-day practice of medicine, both from a clinical side, but also from a business side. And so we'll address some of those questions. And I think the key thing to keep in mind there, and I'll emphasize this point again and again, is, I don't necessarily have answers for all of you. What I do have are questions that we can be thinking about, but the exact answers are going to depend a lot on what happens over the next couple of years and how doctors and practice administrators and hospitals and everyone else in the healthcare system starts bringing the AI into practice and how things are changing. So there's no right answers yet, but there are questions. So jumping right in, why do we care about AI? What can it do? And I think to answer that question, you need to step back just a little bit and think about some of the sort of amazing things that, 20 years people said computers could never do this. And then all of a sudden computers were doing it. And then getting more, as you move closer to the present, 10 years ago, people said, well, okay, computers can do that, but not this. And all of a sudden computers were able to do this. So we have this sort of steady progression of computers becoming more and more powerful, being able to do more and more things that in the past, people just didn't think they'd be able to do. So what sorts of things am I talking about? Many of you might remember Deep Blue and Deeper Blue. These were supercomputers created by IBM, and what they did was play chess. For years, people thought computers would never be able to beat the best chess grandmasters. It's too complicated. There's no way the computers can do it. But then with Deeper Blue, IBM actually managed to create a computer that beat the chess grandmaster, the world champion at the time. And this was a huge accomplishment. But everyone was, before they'd been like, oh, computers will never do that. But then all of a sudden they thought about it and said, you know what? Chess is really a number crunching game, right? There are certain moves, the pieces can only move in certain ways. So yeah, there's a ton of them, and it's impressive what the computer did. But ultimately, this was just number crunching. And if you have enough microprocessors, enough processing power, eventually a computer was going to be able to win at chess. So okay, we get it, but it's all right. So then more recently, yet another example, IBM came out with Watson, and I think everyone probably remembers Watson played Jeopardy, and it played Jeopardy really well. So well, in fact, that it beat Ken Jennings, who at that time was considered the best Jeopardy player who had ever played. And now Watson's a little more, potentially a little more complicated than just what Deeper Blue had done with chess. Right here, it was understanding a question, looking at all the information it had available to it, and coming up with an answer and giving that correct answer. Right, so a little more comprehension in some ways going on here, a little more, to use a term that we're getting into, a little more intelligence. And then even more recently, just a couple of months ago, read an article about IBM's Project Debater. Many of you might have done high school debate. I did not, but even for those who didn't, I think you know the general idea, right? Someone presents an argument and the other side gets up and presents a counter argument based on what was said right there. And IBM's Project Debater computer competed in a tournament with human debaters, and while it didn't win, it did very well. And this to me is yet another step forward when we think about the fact that this computer in the moment was going and taking an argument that someone made and then immediately responding to it, right? It wasn't just taking data that was out there and pulling up a single word answer, right? It was responding almost the way a human would. So we have this history of computers becoming more and more capable and doing more and more sort of things that are like human intelligence. And so this sort of intelligence can have a huge impact. The people at PricewaterhouseCoopers put together what they call an AI Impact Index, and they gave, and this is obviously a ranking of how much impact artificial intelligence is going to have on these various industries. And in healthcare, they gave it a ranking of 3.7 out of 5, which was its highest ranking, tied only with the automotive industry. And now, right now, what's going on in the automotive industry with artificial intelligence? We have the transition to driverless cars, right? That's the big news right now in the automotive industry. And you can imagine the sort of impact that change driven by artificial intelligence is going to have for the automotive industry. And PricewaterhouseCoopers thinks artificial intelligence is going to have that same level of impact on the healthcare industry. And so I think that's saying something about how important AI can be in healthcare. And okay, so it's going to be important, but is it going to be important in 20 years, 30 years? What's it going to be? Well, survey of healthcare executives, one of them, and they expect AI to be widespread in healthcare. 89% of the healthcare executives said they expected it to be widespread in healthcare in less than 10 years. 54% of them said they expected AI to be widespread in healthcare within 5 years. right? So that's a very short time frame when we're talking about some of these issues. Now, obviously, there's often this tendency to say, oh, this next big thing it's going to happen, it's going to be here tomorrow, and then tomorrow actually is a couple of years down the line or further. So is it really 5 years? Is it really 10 years? We don't know for sure, but it's certainly coming, and we expect it to have a big impact. And anytime you expect something to have a big impact in the industry, you also expect there to be big money and big investments in it. All right, so as you see on the slide, $6.6 billion in investments expected by 2021. In 2018, which is the last year I had seen the numbers for, there was funding of $2.4 billion, and that had been an increase of 78% over 2017. So lots of money coming in, and the amount coming in is expanding rapidly. You can also see, the estimated impact, $150 billion in annual savings, 20% of current unmet clinical demand potentially being addressed through new AI tools. So just a big, big impact. So we know it's going to have an impact, but what exactly is AI? I want to start with a very basic definition of artificial intelligence. It's a computer system or software that is able to perform tasks that typically require human intelligence. And the basic idea of artificial intelligence, I think, is very common in popular culture, something we're all probably familiar with if we think about it. Depending on your age, your touch point might be HAL 2000 from A Space Odyssey. If you're like me and grew up in the 80s, your touch point might be more Arnold Schwarzenegger, the Terminator movies with Skynet. Moving closer to the present, you've got the Matrix movies. You have more recently the Marvel superhero movies, a number of artificial intelligence machines in there. Tony Stark has his assistant Jarvis, and they create a bad guy Ultron and a good guy Vision. So lots there, but this whole general idea of artificial intelligence, computers that can act like humans, very common in popular culture. And underlying a lot of this traditional idea of artificial intelligence, I would say, is this fear of being replaced, right? Skynet and Terminator, those were not good things. We're sort of afraid that artificial intelligence is going to come, and then it's going to want to replace humans, or it's going to take our jobs to be a little less dramatic than perhaps the movies are. But there are a number of people who are arguing now that that's not the way we should be thinking about artificial intelligence. Instead, we should be thinking about AI as augmented intelligence. And augmented intelligence refers to the use of AI to improve a person's ability and to assist them. All right, so in the context of healthcare, this would be talking about using AI to get better diagnosis and care. And it's this idea that we're going to be better together. Humans and the AI software working together will end up with better outcomes than either could get alone. And this is definitely the viewpoint that the American Medical Association, many other physician societies are pushing. And I think it's a good one. And I read an article recently that I thought made a good point, and was you could think of AI as a member of the care team, right? Many physicians still practice on their own, but many now are more used to this diet. You're practicing as part of a team, whether either in the hospital or in your clinic or in your office, with nurse practitioners, physician assistants, other support personnel, whoever it may be. We're all part of a team and working together, and different parts of the team have different strengths. And so it's important to think through, if we think about an augmented intelligence world, what is AI good at and what is it not good at? For instance, right now, machines not really good at patient interaction. So you need a person there to interact with the patient, understand what they want. Similarly, thinking through what matters to a specific patient, right? The patient in front of you right at that moment. AI might be able to tell you that the treatment with the highest likelihood of success for a particular form of cancer, they said right now we should go to chemo, but it might not have a high success rate. And so the computer's not going to be good at knowing and talking to that patient and saying, is this right for you, or would you prefer to spend the last month of your life at home with your family not undergoing through chemo? So understanding what matters to a specific patient, as opposed to just understanding in general what might be a good treatment. So they're all strengths and weaknesses, but this is the idea of augmented intelligence, that it works with us, not against us. Well, who decides whether we end up in a world that is an artificial intelligence world or an augmented intelligence world? On the short run, I'd argue there are two main issues that are going to make that determination. First is the current state of technology. In almost all cases, current AI puts us in an augmented world. The artificial intelligence programs and systems right now, they are simply not able to be standalone decision makers, right? They can get you part of the way to an answer, or maybe they haven't been tested on a big enough data set yet, so we're not 100% confident in the results. Or maybe they're very good at such a narrow slice of healthcare that, right, you still need the practitioner to say, this is actually the issue I need you to evaluate, and then the AI can do it. So right now, the technology, right, in the short run, the technology is going to say we are mostly going to be an augmented intelligence world. Second thing is consumer trust. One survey, only 20% of consumers said that they would trust info delivered to them directly by artificial intelligence, right? So if the patients aren't going to trust the information, that can't be how we give care to them. So that's the short run. But what about in the long run? And here, the big driver is going to be laws and regulations. And so you see on the slide, right, examples of lots of the entities that might be involved in this, right? So the FDA does device approvals, software as a medical device. So we know the FDA is going to be involved in some of these decisions, right? Medical boards, we have scope of practice laws in every state. And so if a machine is making certain clinical calls, does that become the practice of medicine that gets regulated by a medical board and that they can say requires a human to still be involved? I'm a lawyer by training. Obviously, we have been dealing with some of those very same issues in law, right? If you have a will template and a computer fills it in for someone, is that the practice of law, right? Does a lawyer need to be involved in there? Well, a little more complicated on the medical side, but the same type of debate is going to happen, right? And then you also have the legislatures, right? Obviously, whether it's a state legislature or the federal government, they can pass laws saying what the machine can and cannot do within their state or the federally, across the country. And our professional societies, whether it's the medical society or MGMA or a number of other organizations, right, they're going to be able to influence laws and regulations both through the expertise that they bring, being able to say, hey, in practice, this is what the AI is actually good at, what it's not good at, and also, just through generally lobbying and expressing the interests of their members. So I think that's sort of the key here, is all these things about who decides. The decisions about the use of AI are being made by people, whether it is people at the FDA, people in government, our elected representatives, members of the medical societies, right? These are all people. And I think that tells us that at least in the short run, it is very likely that we are going to stay in an augmented intelligence world. Humans are going to remain part of the process. But it's obviously not a simple yes-no decision. It's a constantly evolving decision. And every couple of years, people are going to look at it again and say, what's the right balance between keeping people involved and letting these AI software go out and do its thing? And technology can change rapidly, and we know that's going to impact these decisions. So that's sort of the background. But then the question becomes, so what's out there? What is AI doing? And like I said, we're going to start on the operational side of things. And it's doing a bunch of really interesting things here. Some of it is just basic data analysis, and in some ways this probably isn't even artificial intelligence, but I included here just so we can start. So examples, using EHR data to determine where you should send a mobile mammography screening unit because you were able to look in your data and see that these areas had very low screening rates. Maybe you're using it to maximize operating room efficiency and usage. Another interesting one, appointment scheduling, both to schedule the initial appointments, but then also saw one study where they looked at and AI was able to, using the weather and just a couple of other data points, make pretty accurate predictions about which patients were going to not show up to their scheduled appointments. And so, of course, that gives powerful tools to people to then either reach out to those patients to try and make sure they show up, or conversely to change the schedule around it and sort of account for the fact that you're going to have those particular no-shows. Another powerful tool, data scanning, right? We have lots of forms and other things that get filled out, and sometimes you need that information in EHR and you need to check a box, but what if you forgot to check the box and, oh my gosh, we're about to do a surgery and did we get an informed consent? Well, now there are some AI programs that have been trained to scan, some PDFs that have been put into the EHR and look through them at the unstructured text, and they can tell you whether or not there was an informed consent in that pile, right? Saving people the time of needing to go through and find it, right? So this technology, this AI, really helping make operations smoother and quicker. One area that has a lot of potential, I think, is voice, the ability to use voice-enabled artificial intelligence to assist with things. Many people now, certainly not all, but many people have either an Alexa from Amazon or a Google Home device or some other smart home type speaker in their house. And of course, right, these you've talked to, and in my house, they're mostly used for my kids to listen to music, but they have all sorts of uses. So Amazon with Alexa has actually worked with a couple of hospitals now, health systems, to design some tools that are HIPAA compliant and that so information can be accessed through Alexa. You can also use voice to help with a number of things in practice. For instance, note-taking. Here, the idea, and there are different ways to do it. Some people could use the speaker and you can actually have a physical person taking notes and they're just not in the room. But that's not really using AI, but now with AI, you can have the artificial intelligence listen into the conversation, and using the artificial intelligence, take a first stab at transcribing the note for that visit so that the doctor can just be talking to the patient and not clicking away on the computer keys or check marking anything or even writing anything down. In one demonstration project in orthopedic practice down in Atlanta, they found that the time spent creating a note decreased from 4.8 to 1.6 minutes per note, which they estimated saved an hour per doctor per day. And if you think about it, that's a huge number to save a whole hour of a physician's time. And of course, what can you do with that hour? Well, up to you, up to the practice. Maybe the doctor just gets an hour back of their life. Maybe you schedule a couple more patients, increase the practice revenue. But the fact that we're able to save this much time using an AI device, is really remarkable. And then other than that, with voice, just in general, it's things that you can do hands-free. So can you talk to your EHR and get answers back without needing to type in? So voice activated. Similarly, saw one interesting thing where a physician was getting frustrated. He was in surgery, and every now and then they'd be need a medical device, and the one that they'd brought in with them wasn't maybe exactly right once they got in there, and it was a real pain to go out, get back on the computer, and then re-sterilize and come back in. So he had created a voice hands-free program to allow him to just sort of, while he was still in the OR, ask the question of the computer, what device should we be using, get the answer back, and that saved a lot of time, no need so he could stay sterile during surgery. So sort of a very useful way to use this hands-free technology. Other things we're doing with AI on the operational side, big one, chatbots, right? You go to a website, a little box pops up, asks, how may I help you? Sometimes you're communicating with a person, but often it's AI. Mostly in healthcare right now, being used to help triage people. Do I go to the ER? Do I go to urgent care? can I just schedule an appointment with a primary care physician for next week? Also being used for things in the ER, people are waiting around, when are my lab results coming back? And so using some chatbots to help people stay up to date with what's going on. And people really like just being informed, and so that reduces a lot of stress for people in the ER. All in all, so you have all these things going on. You've just got big companies going to hospitals saying, tell me what you need, and how can we help you? And they're going to come in and spend a year trying to work with the hospitals. Obviously, they want to help figure something out that they can sell to lots of hospitals. But there's this idea that AI can come in and really help hospital operations. So that's on the operational side. But what about on the clinical side? And I think this is the side where people get either very excited about the possibilities or often very nervous, because it is a little scary when you think about just a computer coming in and trying to tell you what you should be doing for a patient. But there are a lot of very interesting things going on here. Starting just on the predictive side of things, so long-term outcome predictions can obviously be hugely beneficial. One example, AI was able to look at cancer patients starting chemotherapy and give 30-day mortality predictions. So that obviously is very helpful in deciding should we go forward with this chemotherapy or not. And it was able to look at it across a range of different cancers. Similarly, some AI looking at ways to better identify those at high risk for kidney disease. We know, if you get all the way down the path and you end up on dialysis, that is terrible for the patient. It's hugely expensive for the healthcare system. So if you can identify those people earlier and figure out ways to prevent sort of the slide, that's from a health perspective for the patient, the cost perspective for the system, just an absolute huge win. Another AI out there that 5-year predictions for breast cancer was able to identify 31% of patients at high risk, as opposed to the previous method, which was only identifying 18%. So still a lot of room to improve, but certainly getting better. And the better we are at these sorts of long-term predictions, the better we can do in terms of keeping people healthy. More short-term predictive tools, you can look at things where people are in the hospital and what's going to happen just while they're in the hospital. So Google has some big initiatives looking at EHR data and using just that data to predict in-hospital mortality, 30-day unplanned readmissions, prolonged lengths of stay, and even final patient discharge diagnosis. Right? And so obviously lots of these, if you can see that this patient is at high likelihood for an in-hospital death or a prolonged length of stay, you can sort of get in there early and say, what am I doing? Or what am I not doing that I should be doing for this patient? And sometimes, obviously, we know patients are sometimes just very sick if they're in the hospital, and there might not be anything ultimately that can be done. But having that knowledge, being able to try and get in there early, again, helpful to make better medicine, get the patients healthier. And then once people are out of the hospital or when they're leaving the hospital, a lot of work on AI around trying to look at readmission risk. So Geisinger is doing a project to try and look at COPD-related readmissions using AI. Similarly, Northwell in New York is trying to do something looking at medical history and social determinants of health to determine readmission risk. So again, if you can figure out who's at likelihood of readmission, you can try and intervene early and prevent that from happening. There's also a lot that's going on that can help with diagnostic assistance. So again, it starts at the very bottom with some basic data analysis. There's one thing I read a while back that I thought was super interesting. Apparently, if you talk to someone who's come into the ER and you go back and you look at their Google search history or whatever search engine they prefer, in the week before they actually visited the emergency room, their number of searches for health-related issues, often including the one that they came to the ER for, double. So there's something in the early side that's clicking with them. They sort of have a sense of something's wrong, and and they're trying to figure it out. And so we don't know how to take that yet. Obviously, we don't tie people's searches to them, and there's no one constantly monitoring them. But this idea that there might be ways to help diagnose people earlier, I think, is a very valuable one. And I think it's somewhere that a lot of artificial intelligence is going to try and sort of figure out. You also have, with Diagnostic Assistant, again, looking at EHR data. One really interesting one, a pediatric assistant artificial intelligence program, actually sort of tested over in China, and it looked at common childhood conditions, everything from flu to meningitis, acting as a spot check for doctors, and it was as accurate as doctors on a number of these issues, including asthma, GI disease, where, and so this is great. So you have the doctor's looking at the patient, they're doing everything, and then at the end, the AI does a double check and says, hey, have you thought about this issue? We see you didn't mark it down, but based on the symptoms, we think you should consider this. And the doctor say, oh yeah, that's right, I should look at that. Or maybe the doctors had already looked and said, oh no, that's not going to be an issue for XYZ reason. But this double check, right, it can be a super important thing for doctors. And right now, a lot of AI very much acts as that double check. One of the interesting points that's raised by this particular pediatric assistant, and I mentioned that it was over in China, is AI needs to be trained on data sets, right? In order to know what to do, in order to be smart about the diagnosis, in order to get them right, it needs to have large data sets to look at where it can say, oh, this in the past, these symptoms have correlated with, this diagnosis, or I can look at this image, but you need to see lots and lots of them. And in the US, sometimes that can be hard. We have HIPAA, we have other data privacy protections. So sometimes it can be very hard to get large enough data sets to really be confident in the results that the AI is giving us. In China, they didn't have quite the same restrictions. They were able to find this very, very large data set that they could use for this particular pediatric assistant. So just something to keep in mind with a lot of these AI tools is they're only as good as the data sets they're trained on, and we need really large data sets to get them where we want them to be in terms of accuracy and reliability. Other types of diagnostic assistance that AI is doing, sort of in the traditional vein of diagnosis and screening, looking at fetal heart rate patterns and being able to give early warnings of complications, before a physician or nurse would have identified that an issue was about to happen, and certainly before sort of the alarms would be going off that an issue was in progress. Another interesting one had patients with stable chest pain, and the question was, do these patients need additional cardiac imaging to rule out bigger problems? So the AI was able to say 67% of these patients did not need further testing, while the doctors only said 5% of the patients didn't need further testing. And when they looked at the results, the AI was 97% accurate in saying no more testing was needed. So obviously, with the doctors, basically all the patients are getting new and additional testing, but in many cases, we don't need that testing. And that's waste in the system. It's slowing care for the people who do need the testing. So having AI and being able to get smarter about identifying the people who need further testing, who need more diagnostic work, is super important. Then we also go things beyond sort of traditional diagnosis and into the world of what I call a little more advanced tech, and some of these things I think are really neat. So recent articles last couple of months about a stethoscope that has a little AI program attached to it, and just using the stethoscope in this program, able to identify pneumonia with an 87% accuracy. Got another one with smartphones. Lots of things actually able to be done with smartphones. So with diabetes, there are some changes in blood flow that are associated with diabetes, and using a smartphone camera, the camera itself with the AI is actually able to identify those changes in blood flow and determine whether the likelihood of diabetes sort of at the same level as some of the other ways we go about determining diabetes. So just from a camera and just looking at blood flow. So I thought that's pretty amazing. Another one, smartphone combined with a paper funnel. Uses sound waves and can detect fluid in the ear, which obviously sign of ear infection. And so can you imagine now all these parents who are constantly calling their pediatrician, running their kids to the emergency room, able potentially with just a paper funnel in their smartphone to figure out whether there's an issue that requires them to come in. Again, sort of amazing sort of what this technology is able to do. Another one on the smartphone, which again, I think the technology is amazing. I don't know in practice how useful it will be, but apparently when you are about to overdose, there are slight changes in your breathing, and an artificial intelligence program was able to identify these changes in breathing. So if the app is on, using the smartphone speaker, it hears this change in breathing, it can immediately, it could call 911. It could get help to that person who's in the middle of overdosing. Now, again, I said I'm not sure how practical that is in the real world, because obviously this would mean you would need to have your app on all the time or turn it on when you were about to take drugs that you thought might create an overdose, and so I'm not sure how likely that actually is. But the fact that the artificial intelligence programs were able to identify these changes in breathing, I think that's sort of very impressive and sort of shows the potential of what's there to use very common devices, your smartphone, with artificial intelligence to help us do diagnosis and do other things. And then, of course, there's a big subset of diagnostic assistance, as I mentioned before, imaging analysis. And this is one thing, right? This is what AI, if it's good at one thing, this is it. It's good at looking at images. It helps people, can potentially help people do quicker reads, more accurate reads. And it also, I think, and perhaps the most important part here, can allow non-specialists to get actionable information from images. All right, so how does this all play out? A couple of ways. So for instance, X-ray triaging, artificial intelligence that will identify X-rays with abnormal results, and it can bump those X-rays to the front of the queue so then the radiologist sees them quicker. All right, we think this one is going to be a problem. Now, doctor, look at it, right? And so we can do things quicker. An example of this, just in the last week, so an article, a new FDA-approved device to detect pneumothorax, which is the air leaking into the chest cavity, and can cause a collapsed lung, so sometimes not detected in the ER. And this device is basically a rolling X-ray. Go there, takes the X-ray. If it detects the possible collapsed lung, it triages the image to the front of the line for the radiologist. And also, if you want, it can create actually an alert for the physician at the bedside, so they can try and see if that's an issue right there without even needing to wait for the radiologist to read the scan. So triage there. Similar, there's triaging on the eye care side. Really interesting one, FDA approved IDX-DR. And what this does, takes an image of your eye and determines whether you have more than mild, is the phrasing they use, diabetic retinopathy, right? So you're a diabetic, you go to a clinic to get your normal treatment and assessment, but there's not normally an eye doctor there. So normally you would need to then go schedule an appointment, go see an eye doctor to make sure no problems have gotten worse. But instead now, the clinic can use this device, determine whether you have moderate or severe diabetic retinopathy. If you don't, great, you're done. You come back a year later. If you do, they can refer you to a specialist. So use of AI to do triage with a non-specialist present. Very powerful, great for patient care there. More generally, Google with their DeepMind initiative, this one I believe they're actually doing in partnership with the National Health Service over in Britain, claims that they have 99% accuracy for 50 different eye conditions. That's a pretty amazing accuracy rate, and we need to see more data around it, but that's pretty impressive stuff right there. And one of the interesting things they actually did here is one of the complaints that people have about AI is sometimes it's a bit of a black box. You know, we give it information and it spits out an answer, but we don't know how it got to the answer. And so they designed this AI to address that factor. So it's actually split into two parts. The first part is it takes the image and the AI sort of identifies what it's seeing in the image. And then the second AI takes that output and then looks at it and says, based on that output, this is what we think the diagnosis is. So this way, a doctor looking at it can actually understand how the machine got to its conclusion. Lots of other different types of images that people have looked at. CT scans for lung cancer. One AI program had initial results showed possibly detecting the lung cancer up to a year earlier than a radiologist could detect it. An AI looking at breast cancer had a 39% reduction in missed breast cancers. There was another AI looking at MRI scans for ACL tears and did as well as a team of 5 radiologists. So all sorts of things going on. And again, you know, the ones that I have pictured here, the AI doing better than dermatologists in detecting skin cancer just based on the image. This FDA-approved algorithm to detect risk fractures, right? It highlights and tells the doctor where they should look for the fracture, which in my mind means it probably can just make the diagnosis itself, but they didn't want to go that far. They wanted to keep the doctors in the loop. You know, and I think you see that with some AI devices where they maybe could go further, get approved to be on their own, but no one wants to take that step yet. They're both worried about liability and they're worried about the acceptance by the doctors and by the patients of the results if there's no doctor involved. Lung cancer, another one. Then this last one, this fourth picture here, I think actually is a great one. It's pneumonia from chest x-rays. And this is a great one for anyone who really wants this augmented intelligence world, right? The better together. They had already done, created an artificial intelligence program that was better than humans at diagnosing the pneumonia from the chest x-rays, but it still wasn't great. It was only at something like 60%. And so they combined, they put together something that combined the AI with about 8 doctors, and they had an 82% success rate, right? So better than the AI by itself, better than the doctors by themselves. So this idea of better together. And so for anyone who, you know, is looking to keep humans involved in the practice of medicine, I think that's, you know, potentially very good news, and it's maybe something we'll see in lots of other areas as well. So I've just sort of talked a lot about all these AI programs doing so well, and aren't they great? But obviously you need to have at least a little caveat with that. Recent meta-analysis that was published in Lancet's Digital Health, I think just within the last 2 weeks, and it made the point, and it's a very good point, that very few of these studies comparing how well AI diagnosed something to how well doctors diagnose it, very few of them actually use the doctor and AI looking at the same data set. All right, so what normally happens if you have some study somewhere that showed how accurately doctors diagnosed something, and then this new AI comes along and they do a separate study of how well did this new AI diagnose that same thing, and then they compare the two rates. But obviously the doctors and the AI looking at different sets of images, so there's no way to say that they actually, if they'd switched sets, would their error rates be the same? We don't know. So the gold standard is really to have them compare the same, look at the same data set, and we just don't have a lot of that yet. I don't know that it's going to hugely change the results, but it's something to keep in mind. So a lot of really great stuff there that from the AI, these programs are doing a lot of amazing things. But obviously what we want to know is, what does that mean for doctors? What does it mean for us? And there are 4 main issues that I'm gonna sort of talk about. Again, like I said at the beginning, these are more questions to think about. I don't have specific answers. I don't think anyone has specific answers right now. But if we wait until AI has been implemented and we're all doing it, you know, then it's going to be too late to think about some of these issues. So you want to get out in front of the game now And simply by the fact that you are on and listening here, I think you all are already ahead of the game, ahead of many of your peers. So potential implication, first one, what does it mean for physician roles? Right now, doctors have a lot of autonomy, decision-making authority. Well, in this future world where there's also AI in the practice, what happens when the doctor and the AI disagree? Do you always go with the doctor? Does the AI get to override the doctor? Do you bring in a second physician to be a tiebreaker? Right? There's no right way to do it, but it's very much going to change the sense of autonomy that physicians currently have, and that's going to be a hard adjustment for many people. How does it change your daily responsibilities? So we know, for instance, many of these AI programs that look at images sort of can give a confidence about their diagnosis. You know, I'm 90% confident that this is pneumonia or whatever it might be. But others, it might only be 60% confident. So if that's the case, maybe you change sort of how what the physicians do on a daily day, and your newest physician gets the ones that the AI is 90% confident on, so they can sort of learn and get trained up by looking at the ones where there's less likelihood that they're going to make a mistake, while your most experienced physician gets that image that the AI really isn't sure about, right? So you might change how people what they actually do day to day in the practice. Obviously, another big one is staffing levels, and that both physician staffing levels, but also support staff levels, right? So if the AI allows you to treat patients twice as quickly, or say, read twice as many images, do you need as many physicians? Do you need as many staff? Well, maybe you're able to now do twice as much volume, and so you want the same number of people, but maybe not, right? So we don't know exactly how it's going to play out, but if you're going to be implementing AI, it's certainly something you want to be thinking about. What does it mean for reimbursement, right? It can go two very different ways. All right, I've got this artificial intelligence program. It allows me to treat more patients more quickly. So great, I get more revenue. That's awesome. I love AI. On the other hand, right, the insurance companies know that AI is coming. So as more people adopt it, maybe they change their reimbursement and you get less per patient or per treatment because they know you're using AI. Well, if you're a practice that hasn't adopted AI yet, right, and now you're seeing less reimbursement per patient, that's going to be a big decrease in revenue for you, and that's going to be a real problem. You know, so it can go either way with the reimbursement. Also, the possibility that AI allows you to enter more into value-based care arrangements. So, for instance, predictive AI mentioned the attempts to identify people at high risk for kidney disease to prevent dialysis. If you're on a value-based care contract and you can prevent 1, 2, 3, 10 people from ending up on dialysis, which is hugely expensive, all of a sudden, in addition to having better care for the patient, you're having a huge savings from that, and that's going to end up in more revenue for your practice. So, right, lots of implications for AI on reimbursement. Obviously, a big issue for me, since I work at a medical malpractice company, is what does AI mean for liability risks and who's responsible, right? And this is a big issue for everyone. One study of healthcare leaders was asking, like, what would stop you from implementing AI, right? So 30% were afraid patients wouldn't trust AI, 30% were afraid doctors wouldn't trust the AI, and 54% were afraid of a fatal error caused by the artificial intelligence. So this is very much one of the issues that needs to be confronted before people are really going to adopt artificial intelligence. You know, and lots of different ways this could play out. I mentioned before what happens when a doctor and the artificial intelligence have a conflict, and from a liability standpoint, this is probably a no-win situation, right? Doctor overrides the AI and something bad happens, the plaintiff's attorney is going to say, well, obviously it's malpractice, the AI told you what to do and you didn't listen. But on the other hand, if the doctor and AI disagree and the doctor goes with the AI and something bad happens, well, again, plaintiff's attorney is going to say, doctor, you're the one in charge. You abdicated your responsibility. You're at fault for the fact that something went wrong. So it's, again, might put doctors in a little bit of a no-win situation if bad outcomes occur. The issue of AI being a black box, like I talked about before, and the inability to explain how it came to its decision, right? So how do you defend the care at trial if you can't explain the decision? You know, can the doctor review the AI's reasoning? And if not, how do you talk about that at trial? And then, of course, there's the question of whether are we even capable of understanding how the AI gets to its answer. So if it gets it right more often than we do, you know, there's some argument to be said, like, it doesn't even matter how it gets there. You know, we talked about DeeperMind at the very beginning in chess, so use that as an example. You know, I can probably look 2 moves ahead in chess. You know, so if you wanted to explain to me why you made a move and you wanted to explain the next 2 moves and everything else, I could probably follow that. But if Deeper Blue or a grandmaster tried to explain to me why they made a move and it's because of what's going to happen 30 moves down the line, well, I don't know that I'm even capable of understanding that. And so some of the AI might be like that. It might be seeing things that we just aren't capable of seeing. And, you know, we don't want to stop the AI from being more effective in the same way that DeeperMind is more effective because it could see more moves down the line. But that does put us in a hard position from a liability standpoint. Also need to worry about issues of health equity or AI bias, right? So this is a variation of garbage in, garbage out. The training data that the AI looks at might have a diagnostic error rate. So if it has a high error rate, maybe we can't rely on the results of the AI. Similarly, we know different populations present with different illnesses in different ways, but we don't know whether or not the AI training data actually included all those populations. So if the training data was all white men and you are a black female, it might not diagnose you correctly. And that obviously is both a concern from a health standpoint, but also from a liability standpoint. Big issue also as well, who's responsible, the physician or the AI company, if the AI gets it wrong. Another way of saying this is this a medical malpractice issue or is this a product liability issue? And different rules will apply, and we don't know how the courts are going to come down on this in the long run. In the short run, what I can say is indemnification provisions in agreements with any company. If you are purchasing an artificial intelligence software program, I would focus very much on those indemnification provisions. That's really the best way to protect yourself right now. Will you be able to get an indemnification? Just sort of depends on the company, how big you are, how big they are. But something to keep in mind. And then finally on that, you know, is at some point is it going to reach the point eventually where using artificial intelligence is considered part of the standard of care? And if you're not using it, is that just going to be evidence of malpractice? And it's you know, we're a long ways away from that, but it very much is something we want to keep in mind. Final quick issue to mention, lifestyle issues, you know, right? Physician burnout. Right now we know about 40% of physicians already experience burnout. Is AI going to make this better or worse? Well, I could see how it could go either way. From a negative perspective, right? Physicians saying, all I'm doing now is babysitting a machine. This is not why I got into medicine. I'm miserable, right? That leads to more burnout. Similarly, right, we know people have all sorts of issues with the electronic health records and the user interfaces are terrible. Well, if the AI interfaces are bad, again, adding to more burnout. But on the flip side, ending on a more positive note, right, you also can see a world in which AI deals with a lot of the rote issues, the sort of mundane cases, and it leaves the doctor with more time to do face-to-face interaction with patients, gives them more time to deal with the most interesting cases, right? And that obviously could be a huge boon to their engagement and could lead to lower burnout. So lots of issues here. We have, you know, a lot of really interesting technology. Artificial intelligence holds a lot of promise. Obviously, as we talked at the beginning, PricewaterhouseCoopers and others expect to have a huge impact on physician practices. What those impacts will be, how it plays out, we don't know, but we do have some questions that we can start thinking about. But there's a lot here, and I'm very much interested to see sort of what the future holds with artificial intelligence and how it's going to impact physician practices. And so with that, we'll just turn over to any questions.
Thank you, Sam. We do not have questions right now, so if anyone has some questions, there's a question box located on the right of your screen where you can type them in. We will give that a couple seconds. Alrighty, if we don't have any questions today, then we can wrap this up. Once again, let me see. We have courts decided on a product versus medical liability to date?
They have not. I know there have been some cases now which have involved both the company that had the AI, or it wasn't an AI product, but the product, as well as the physician, both were sued. And so they didn't necessarily decide that question of is it a product liability case, is it a medical malpractice case, but the results end up being bad when you have both two people on the defendant side, right? The easiest thing is they all want to point fingers at each other, and then that makes the plaintiff's attorney's job very easy. They don't actually need to do anything. The defendants just attack each other. And so that has happened, but the courts themselves have not really given guidance here. They're still even trying to decide questions like, if a physician is going to comment on the diagnosis given by an AI, do they need to have a computer programming background so they can even understand the AI itself, not just the medicine side? So all those questions, there's no consensus yet, no decisions, and I don't think it's going to be you're going to have one case that makes a decision. You're going to have lots of cases in lots of different states, potentially coming to different outcomes, and then over 10 years they start coming towards a similar result. But I think right now we don't have an answer, and I think even in the short run, even when you get the first cases or two, they're not actually going to give you a definitive answer. It's going to be a long process before we really know.
Thank you. The next question is, how much will robots play into artificial intelligence?
I'm not entirely sure I understand the question. Certainly, if the question is, will these AI devices be in the form of robots, or will they be in the form of, sort of something that analyzes images on your desktop? I think for the foreseeable future, we're going to be more about sort of these programs that give you results, and not about an autonomous doctor robot that walks around seeing the patients and doing everything. I don't see us being at that point for a very long time. One of the things I mentioned towards the start was this idea of the human interaction with the patient, and so that's not necessarily, is it feasible for a doctor robot? That's more about, do the patients want a robot to be their doctor? And at least right now, that doesn't seem to be the case. But could it happen? Sure. I think that's much further off, though.
Yep, she actually expanded her question a little bit. She said, do you expect Da Vinci or the other robots to have AI learning capacity to refine how they interact with surgeons? Yeah, so I do think there will be some of that, and there's going to be more potentially actually on the end of AI devices actually doing treatment themselves. I think we will move towards that path. One of the things I didn't mention, was some of that treatment side of things, because we're just really starting to get there. And so there was a device recently, AI-guided device that could take the place of an endoscopy, right, to look for colon cancer, and it used magnets to guide this device through and get all the images it needed and everything else. And so that was an AI-guided actual treatment. And so we are just entering that phase.
in terms of things that might happen a little before that, there is this question with some of these AI devices. So the FDA might approve them, but are they going to keep getting smarter? They're going to see more and more images. Can they train themselves to keep getting better as they're actually out there in the wild and seeing more things? Or if it does that, is it a new device that needs FDA approval again? And so the FDA is trying to grapple with that right now. And so I think that might come into play a little more about what you're saying there is the, you know, the robotic surgery device going to basically have this interaction either with the doctors or learning from what it's done. And we're trying to figure out, that question is being thought about right now, and it is certainly possible that could happen, but it does raise these questions about, is it now sort of basically a new device, and does it need new approval, and sort of how do the regulations deal with that?
Thank you. And the last question that we have is, how can we say that we may not understand how AI makes its decisions if we are the ones programming the algorithms?
So the way some of these AI work, what they call the deep learning or neural networks or whatever else, is we basically throw a bunch of stuff in there. And so we might tell it, like, here's the outcome, and here are all the images, right? So let's just take images. Here are all the images. We know this one had cancer, this one did not. This one had cancer, this one did not. Now, the learning method, and I am not a computer scientist, so I might be describing it slightly wrong, but the computer basically looks at that and it looks for correlations between all the different images that have cancer and the ones that don't. And it finds something that it identifies as being the important part as to determining whether there's cancer or not. And we don't know what that is because the computer has decided, right? We're not going in and saying, we're not telling the computer, if you see this, that equals cancer, now go look for it. We're saying, these pictures show cancer, you figure out what's common about them, so then you can look at cancer in a new picture. Or another example, I think it's some of the ECG type things where they're predicting outcomes, and best guess seems to be that what they are predicting is some change in the slope of the curve that we can't see by the naked eye. But we don't know what it's looked at all these ECG readings, and it's found something that it thinks is consistent across whatever outcome it was looking at. And so now it looks for that particular thing in all these other tests. But so it's not that we are not actually writing an algorithm in the way you would think about it, right? We're not giving the computer a differential diagnosis. Look for this. If you see this, here are your next 3 things to look for. If 2 of them, you know, look at this other thing. If only 1 of them, look at this different thing, right? We're not doing that. That's not how most of these AI programs work. This is much more, we dump the data and it just looks at it, and, you know, and we don't know what it's looking at necessarily. We can program some of them so at the end they will tell us what it looked at, but we still might not understand why that's important.
Thank you, Sam. So if there are no further questions for today, then we will wrap this up. Once again, the presentation slides have been emailed to all participants, and the recording will be available on our website for members only. If you did not receive a copy of today's presentation, please reach out to your state MGMA email, and I will be happy to provide that for you. If you have any additional questions, please feel free to reach out to the presenter directly. Thank you, everyone, for attending, and thank you, Sam, for a great presentation. Hope you all have a great day.
Thank you all.